Good evening, friends. Thank you so much for joining this live session. Today, on Change Agents Foundation, we have a special guest, Dr. B. Mohan. Before I invite him on live, I would like to share about Change Agents Foundation. Change Agents Foundation was started in June 2020 to raise awareness around physical, mental, and emotional well-being of human beings. With that intention in mind, I started calling experts in their domains in health, mental wellness, and relationships. And these are the several areas that I was focusing. And with the amount of experience and the expertise, we had more than 8 guests so far. We will continue to have more of such programs with an intention to raise awareness around these aspects. Today, I'm going to invite Dr. B. Mohan. Before I do that, I would like to take you through his profile. Dr. B. Mohan is the chairman and chief of diabetology at Dr. Mohan's Diabetes Specialty Center at Chennai, which is an international diabetes federation center of excellence in diabetes care. Mr. Mohan oversees a chain of 48 diabetes centers across 8 states of India and has over 5 lakhs registered diabetes patients in his center. He is also the president and director of the Madras Diabetes Research Foundation, which is Asia's largest standalone diabetes research center. Deeply interested in research from his undergraduate medical days, Dr. Mohan has published 1,300 papers in peer-reviewed journals. This includes 843 original articles and 289 review articles, and he has invited editorials in 161 chapters to textbooks on diabetes. I'm sure this is a very phenomenal milestone. His research has attracted over 123,000 citations. His research has a H index of 129. People in the field of research will know what H index is, and his H index is of 129. Dr. Mohan has trained over a large number of physicians and diabetologists, in addition to nurses, educators, and technicians. He has received over 180 awards, including the prestigious Dr. B.C. Roy National Award by Medical Council of India and Dr. B.R. Ambedkar Centenary Award from the Indian Council of Medical Research, the highest biomedical research in India. He was also conferred Dr. Harold Rift and Distinguished International Service in the Causa of Diabetes Award by the American Diabetes Association, and he is the first Indian to receive this award. Recently, he has been conferred the Fellowship of Royal Society of Edinburgh. Dr. Mohan is one of the few medical doctors in India to have been awarded by FRCP. For his extensive contribution in the field of diabetes in 2012, he has been conferred one of the highest civilian awards, that is Padma Shri, by the government of India. This is just a brief of his profile, my dear friends, and I'm very glad and I'm honored to have him as a guest on Change Agents Foundation today. Make the best use of his availability and his presence today. I'm glad to invite him. Sir, welcome. Vanakkam, sir. Good evening.
Welcome. Thank you, Manikandan, for that kind introduction, and I must congratulate you. Within 4 to 6 weeks, you have done so much through Change Agents. It's a very good name also. I like that. You're a change.
Thank you.
In other words, you're an influencer. And it's very nice to talk to people who have such a noble thought in their minds. And therefore, when you invited me, I readily agreed. So I'm glad to be here.
Thank you so much for that. And though it is intended for raising awareness for a social cause, and I'm becoming popular by inviting a very special expert guest. If I have to recall one quote from the book called Outliers by Malcolm Gladwell, he says 11,000 hours. He'll say someone who wants to develop an experience in a particular field, he has to put in 5 years of hard effort, consistent effort. But I'm talking to someone with over 50 years of expertise, and I don't know what to say, and I can't even calculate how many hours it is. I'm totally amazed and astonished.
இந்த புக் வந்து நானும் படிச்சிருக்கிறேன். 10,000 hours வந்து இட்ஸ் ஆக்சுவலி ட்ரூ. ஸோ ஒரு 2 வாரம் முன்னாடி வந்து நான் ஃபேஸ்புக் லைவ்ல கீத் சேத்தி இருக்கார்ல, நம்ம வேர்ல்டு பில்லியர்ட்ஸ் சாம்பியன் ஃப்ரம் இந்தியா, அவர்கிட்ட நான் பேசும்போது அவர் என்ன சொன்னார்னா, கரெக்டா 10,000 எனக்கு ஆச்சு. அவர் எத்தனை வருஷம்னு கால்குலேட் பண்ண, எத்தனை வருஷம் ப்ராக்டிஸ் பண்ணாரு வேர்ல்டு சாம்பியன்ஷிப் வர்றதுக்கு. கரெக்டா அந்த நம்பர் ஆஃப் இயர்ஸ் பார்க்கும்போது 10,000 ஹவர்ஸ் கரெக்டா வந்து, அதனால ஐ பிலீவ் இன் தட்னு அவர் சொன்னாரு. பல சாம்பியன் சச்சின் டெண்டுல்கர் எடுத்து பாருங்க, யார் எடுத்து பாருங்க, அந்த லெவல் ஆஃப் ஹார்ட் ஒர்க் பண்ணலன்னா யூ வில் நாட் ரீச் தட் லெவல். ஸோ வேர்ல்ட் கிளாஸ் பண்ணா யூ நீட் தட்.
ஸோ இன்னைக்கு நம்ம எடுத்துக்கிட்ட தலைப்பு உங்களுக்கு தெரிஞ்ச மாதிரி டயபெட்டிஸ், the recent trends 2020, so the prevention and treatment methodologies. So நம்மளோட டிஸ்கஷன் it is going to center around that. So to start with, என்னுடைய முதல் கேள்வி அப்படின்னு பாத்தீங்கன்னா it will be a very ஒரு அடிப்படையான பேசிக் கேள்வியா இருக்கும், but definitely for the viewers it will be very new, and to hear it from you, it will be definitely a message for them. Diabetes அப்படிங்கறத பத்தி அப்படின்னா என்ன, அதனுடைய காரணிகள், what are the causes of diabetes, please?
ஸோ நீரிழிவு நோயின்னு சொல்றது, சர்க்கரை வியாதின்னு சொல்லுவாங்க, நீரிழிவு நோய் டயபிட்டிஸ்னு இங்கிலீஷ்ல சொல்லுவோம். இது வந்து ரத்தத்துல சர்க்கரையினுடைய அளவு அதிகமா இருக்கக்கூடிய ஒரு நிலை, அதுதான் நீரிழிவு நோய். அப்படின்னு அதிகமா இருக்குதுன்னு சொல்லும்போது நிறைய பேருக்கு என்ன நினைக்கிறாங்கன்னா, நீரிழிவு நோய் இருக்கிறவங்களுக்கு தான், டயபிட்டிஸ் இருக்கிறவங்க தான் சுகரே இருக்குது, மற்றவங்க வேல்யூ 0 இருக்குதுன்னு நினைச்சிட்டு இருக்காங்க. அந்த மாதிரி கிடையாது. இந்த குளுக்கோஸ்ன்னு சொல்றது நம்ம உடம்புல ஒரு ஃபியூவல் மாதிரி. இப்போ காருக்கு வந்து எப்படி பெட்ரோல் இல்லைன்னா கார் ஓடாது இல்லையா, 0 இருந்தா எப்படி ஓடும், அதே மாதிரி வந்து நம்ம உடம்புல வந்து ஒரு சர்டன் லெவல் ஆஃப் அந்த குளுக்கோஸ் இருந்தாதான் அது வந்து செல்ஸுக்கு போய், பிரெயினுக்கு போய், ஹார்ட்டுக்கு போய், டைஜஷனுக்கு போய், எல்லா ஆர்கன்ஸுக்கும் ஒர்க் பண்ணணும்னா எனர்ஜி கொடுக்கறது அந்த குளுக்கோஸ் தான். ஆனா அந்த லிமிட் வந்து 80 கீழே போகாது, ஒரு 120 130க்கு மேலேயும் போகாது. அது எப்போ அது ஏற ஆரம்பிக்குதோ, ஃபாஸ்டிங்லயே வந்து 130 140ன்னு போக ஆரம்பிச்சதோ, குளுக்கோஸ்லாம் சாப்பிட்ட பிறகு 200 300லாம் போயிடுச்சுன்னா, இந்த 3 மாசம் கண்ட்ரோல் டெஸ்ட்னு ஒன்று இருக்கு, HbA1c, அதுல வந்து ஹையா வந்துடுச்சுன்னா, அப்படி வந்துடுச்சுன்னா அப்போ உங்களுக்கு சுகர் இருக்குதுன்னு அர்த்தம். ஆனா இந்த சுகர் வந்து பல வகையான சுகர் இருக்குது, அதை பற்றி வந்து நம்ம பேசலாம். ஸோ ஒவ்வொருத்தனுடைய காரணம்னு பார்க்கும்போது ஒவ்வொரு வியாதிக்கும், ஒவ்வொரு டைப் ஆஃப் டயபெட்டிஸ்க்கும் டிஃப்ரெண்ட் காரணம் இருக்கு.
ஓகே ஓகே. ஸோ இப்படி நீங்க சொல்லும் பொழுது அதனுடைய வகைகள் என்னென்னவா இருக்கு சார்? இப்போ டயபெட்டிஸ் அப்படிங்கிறது வந்து இப்போ யாராவது ஒரு 50 வயது 60 வயது யாராவது ஒரு கல்யாணத்திலயோ ஏதாவது ஒரு பப்ளிக் விசேஷங்கள்ல மீட் பண்ணும்போது, என்னப்பா உனக்கு சர்க்கரை இருக்கா, மெடிசன்ல இருக்கியா, நல்ல டயட் எடுத்துக்கிறியா, இதுதான் முதல் கேள்வியா இருக்கு. ஸோ அப்படி இருக்கும்போது இது வந்து ஒரு 50+ ஒரு வியாதியா, இல்ல இட் அஃபெக்ட்ஸ் ஆல் ஏஜ் குரூப்ஸா அப்படிங்கிறது, இதனுடைய இன்சிடென்ஸ் பத்தி கொஞ்சம் சொல்லுங்களேன் சார்.
ஸோ நீரிழிவு நோய் டயபெட்டிஸ் சொல்லும் போது பல டிஃப்ரெண்ட் டைப்ஸ் ஆர் தேர், ஒரே ஒரு வகைன்னு சொல்ல முடியாது. எல்லாருக்கும் அந்த குளுக்கோஸ்னோட அளவு வந்து அதிகமா இருக்கும், அதான் காமனா இருக்கிறது. ஆனா அதுல வந்து டைப் 1 ஒரு டைப் இருக்கு, இது வந்து பெரும்பாலும் குழந்தைங்களுக்கு தான் வரும். அப்புறம் வந்து டைப் 2, யூஸ்வலி டைப் 2 கம்ஸ் இன் அடல்ட்ஸ். ஸோ கொஞ்சம் வயசான 30 வயசு 40 வயசு மேல இருக்கிறவங்களுக்கு வரலாம் டைப் 2ன்னு சொல்றது. கர்ப்பமா இருக்கும்போது அவங்களுக்கு வரும், ஜெஸ்டேஷனல் டயபெட்டிஸ் சொல்லுவோம். சிலவங்களுக்கு இந்த கல்லு ஃபார்ம் ஆகும் இந்த கணையத்துக்குள்ள, அதனால ஃபார்ம் ஆகும், அது வந்து ஃபைப்ரோ கேல்குலஸ் பேங்க்ரியேட் டயபெட்டிஸ், FCPDன்னு சொல்லுவோம். ஜெனட்டிக் டைப்ஸ் இருக்கு, மோடின்னு சொல்ற ஒரு டைப் இருக்கு, இந்த ஃபாதர் மதர் கிராண்ட் ஃபாதர் எல்லாருக்கும் அப்படியே வரும், ஜெனட்டிக்கா வரும், அது ஒரு டைப் இருக்கு. இந்த மாதிரி சொல்லிட்டு போனா ஒரு 40 வெரைட்டி இருக்கு டயபெட்டிஸ்ல. ஆனா மோஸ்ட் காமன் வந்து டைப் 1 டைப் 2. ஓகே, டைப் 2 எடுத்துட்டீங்கன்னா 90%, மோர் தென் 90% ஆஃப் ஆல் டயபெட்டிஸ் டைப் 2. சின்ன வயசுல நீங்க கேட்டீங்க எந்த வயசுல வரணும், நியூ பார்ன் சைல்டு கூட வரலாம், அதுக்கு நியோனேட்டல் டயபெட்டிஸ்ன்னு சொல்லுவோம். பிறந்து ஒரு வாரம் கூட ஆகல, அதுக்குள்ள வந்து நீரிழிவு நோய் வந்து வந்துடும். ஸோ அந்த மாதிரி எல்லாம் வரும்போது அப்புறம் வந்து எந்த வயசுல வரலாம், 90 வயசுக்கு கழிச்சு கூட சிலவங்களுக்கு வரும். என் கிராண்ட் மதர் வந்து அவங்களுக்கு ஒரு 80-85 வயசா இருக்கும்போது, எனக்கெல்லாம் சுகரே வரலப்பா, ரொம்ப சந்தோஷம், நாங்க 90 வயசு ஆகிறதுக்குள்ள அவங்களுக்கு வந்துருச்சு, சிவியரா வந்துருச்சு. ஸோ அந்த டைம்ல கூட வரக்கூடாதுன்னு இல்லை, எப்போ வேணா வரலாம். சரி, எனி ஏஜ் யூ கேன் கெட் டயபெட்டிஸ். காரணங்கள்னு எடுக்கும்போது டைப் 2 டயபெட்டிஸ் இஸ் 90%. நான் சொன்ன மாதிரி அதுல வந்து முக்கியமான காரணம் வந்து ஹெரிடிட்டரி ஃபேக்டர். ஸோ அப்பாவுக்கும் அம்மாவுக்கும் சுகர் இருந்தா வர்றதுக்கு வாய்ப்பு இருக்கு. எடை அதிகமா, உடல் பருமன் அதிகமா இருந்தா வர்றதுக்கு சான்ஸ் இருக்கு. ஸ்ட்ரெஸ் அண்ட் ஸ்ட்ரெயின்னால வரும், இர்ரெகுலர் டயட் ஹேபிட்ஸ்னால வரும், எக்ஸசைஸ் இல்லைன்னா வரும். ஸோ தீஸ் ஆர் த காமன் காசஸ் ஆஃப் டயபெட்டிஸ். டைப் 1 டயபெட்டிஸ் சொல்றது இட்ஸ் டிஃபரெண்ட் டிசீஸ். சின்ன குழந்தைங்களுக்கு வர்றது வந்து அது வந்து என்ன வரும்னா, ஐதர் வைரஸ் அட்டாக், இந்த கோவிட் மாதிரி ஏதாவது ஒரு வைரஸ் வந்து அட்டாக் வந்தா வரும், இல்லைன்னா ஆட்டோ இம்யூனிட்டின்னு சொல்றது, பாடியில வந்து நம்ம பாடியில வந்து எதிர்ப்பு சத்து இருக்கிற செல்ஸ் இருக்கின்றன, லிம்போசைட்ஸ் லூக்கோசைட்ஸ் சொல்லுவோம். இதை வந்து நம்ம பாடியை அட்டாக் பண்ண ஆரம்பிச்சுன்னா ஆட்டோ இம்யூனிட்டின்னு சொல்லுவோம். அதாவது ஒரு ஃபாரின் பாடி பாக்டீரியா உள்ள வருது, அப்போ நம்ம செல்ஸ் எல்லாம் போய் அதை போய் தாக்கணும். இது என்ன பண்ணுதுன்னா நம்ம பேங்க்ரியாஸை பார்க்கும்போது இது ஏதோ ஃபாரின் பாடின்னு சொல்லிட்டு அதை போய் சுட ஆரம்பிக்குது. ஸோ அப்படி வரும்போது ஆட்டோ இம்யூனிட்டிஸ் எல்லா செல்ஸும் டேமேஜ் ஆகி போயிடும். அப்போ சைல்டுக்கு வந்து டைப் 1 டயபிட்டிஸ் வந்துச்சு. டைப் 1 டயபிட்டிஸ் வந்துச்சுன்னா இன்சுலின் தவிர ஒரு ட்ரீட்மெண்ட்டும் கிடையாது. நீங்க சொன்னீங்க 50 வயசுக்கு அப்புறம் வந்து மீட் பண்ணும்போது எல்லாரும் டயபிட்டிஸ் பற்றி பேசுவாங்க. ஏன் டயபிட்டிஸ் பற்றி பேசுறாங்கன்னு புரியல, பட் எனிவே அது பண்றாங்க அவங்க. ஸோ அந்த மாதிரி பண்ணும்போது ஏன் அந்த மாதிரி எல்லாரும் பேசிக்கிறாங்கன்னு கேட்டீங்கன்னா, நீங்க சொன்னது ரொம்ப கரெக்ட். எங்க ஸ்டாட்டிஸ்டிக்ஸ் பிரகாரம், நம்ம சென்னையில பண்ணி இருக்கிற ஸ்டாட்டிஸ்டிக்ஸ் பிரகாரம் நீரிழிவு வந்து அப்படி ஏறிட்டே போயிருக்கு. முதல்லலாம் 2% தான் இருக்கும், அப்புறம் 10%, 20%, 25% ஆயிடுச்சு. 25% சொல்றது வந்து 20 வயசுக்கு மேல்பட்டவங்களுக்கு. இதுவே வந்து 50 வயசு 55 வயசு மேல்பட்டவங்களுக்கு நீங்க பாத்துட்டீங்கன்னா 50% இருக்கும் இன்சிடென்ட்ஸ் வந்து 50%. ஸோ 50% at age 50 சென்னையில, டெல்லியில, பெங்களூர், ஹைதராபாத் பாத்தீங்கன்னா 51 out of 2 இஸ் டயபெட்டிக். அண்ட் அனதர் 25% வந்து ப்ரீ டயபெட்டிக் ஸ்டேஜ் இருக்கு, அந்த ஸ்டேஜ் பிஃபோர் டயபெட்டிக். அதுவும் இருக்கு. ரெண்டும் சேர்த்தீங்கன்னா 75% ஆகி போச்சு. 25% தான் நார்மலா இருக்காங்க. ஸோ ஆக்சுவலா அவங்க பேசும்போது அது பற்றி தானே பேசுவாங்க. 2 out of 3 வந்து அவங்க மீட் பண்ணும்போது அவங்களுக்கு சுகர் இருக்குன்னா எனக்கு வேண்டாம்னு சொல்லுங்க, சுகரா சார் எனக்கு இருக்குதுன்னு உடனே அவங்க பேசுவாங்க அதை பற்றி.
சோ ரெண்டு பேரும் கனெக்ட் பண்றதுக்கு அது ஒரு முக்கியமான விஷயம் ஆயி போச்சு. இப்போ
அதே ஒரு ஃப்ரெண்ட்ஷிப் எல்லாம் ஃபார்ம் பண்ணிடுறாங்க டயபெட்டிக்ல.
So yeah, viewers, welcome Raghupati, welcome Mubin, welcome Gaurav. Gaurav is asking us to, can you explain in English அப்படினு கேக்குறாரு. Gaurav, we will do this.
தமிழ்ல பேசினா இங்கிலீஷ்ல பேசுங்க, கொஞ்சம் கொஞ்சம் மாத்தி மாத்தி பேசலாம். Yeah,
we will try to balance so that you will get the message. That's what I can say.
So Raghu, yeah, Raghu asked the question, no? So Raghu,
yeah, simultaneously we'll take the questions also, sir.
Okay.
What would be the ideal daily routine or food habits that you would recommend for diabetes?
The first thing for a diabetic patient is to reduce the amount of carbohydrate, because carbohydrate is the one which gets converted into glucose immediately. There are 3 types of diet that we talk about. One is carbohydrate, the other is protein, the other is fat. Only 3 things are there, what we call as macronutrients. Now, carbohydrate directly gets converted into glucose, whereas fat and protein has to get converted into something and then it has to get converted into glucose. So it takes longer time. So the more carbohydrate you take, what is carbohydrate? All sweets are carbohydrate, all sugar is carbohydrate, rice is carbohydrate, potato is carbohydrate, wheat is carbohydrate, all these are carbohydrate. What we do when we start eating in India is, if you are in South India, in Chennai, first we'll put rice, okay, 1 mountain of rice, that will be for sambar. Next mountain of rice for rasam. Next mountain of rice for curd or for thing. 3 mountains of rice already gone. அதுக்கப்புறம் வந்து ஏதாவது ஸ்வீட் இருந்தா அது சாப்பிடுவோம், இல்லைன்னா வேற ஏதாவது. So what happens is the amount of carbohydrate is going up and up and up. We hardly eat any vegetables, salads, protein, nothing is there. What I am saying is, when you if you have diabetes and you want to control your diabetes, first put vegetables on your plate. Half the plate you put vegetables. Quarter plate must be reserved for protein. புரதம் சத்து. அது from where does it come? Protein can come from fish or chicken, white of the egg. These are all very good sources for a non-vegetarian. For a vegetarian, you have to get it from Bengal gram, green gram, black gram, mushroom, soya, all milk. All these are good sources of protein for a vegetarian. You can't get it from anything else. Okay. So there must be one portion of your plate reserved for protein. Whether it's Bengal gram, green gram, black gram, sundal, mari. If you have one part of it kept for that, the last part of it you keep for rice. That a small quantity of rice is also needed. You take half or quarter of what you're taking now, that is enough for you. That will give you the glucose that you need. The rest of it will give you vitamins, minerals, antioxidants, protein. All the things that you need in your diet will come from the rest. So if you control your diet well, secondly, if you exercise regularly, half an hour to 1 hour walking every day, you will be able to control your diabetes well. Of course, medicines may be needed. Now, most people, the moment you talk about medicines, doctor, give me diet. I'll control by diet and exercise. I wish it was so easy. If it's so easy, then you don't need Dr. Mohan to treat you. I can just get one dietitian and say you treat. But why they're coming to us? Why we have to have 48 centers? The reason is because it is more complicated than that. There is something called beta cells in the pancreas. They're not working. Just by cutting down on diet, you cannot cure your diabetes. That reversal of diabetes, everybody talks about in social media now. They come and say, come to me for 2 days, I'll cure your diabetes. I wish it was so. If that is so, why is diabetes going up like this? In India, it's going up like all the cures that we had, but sugar is going up like I'm saying 50% of the people are having diabetes. Why? The reason is because with age itself, your beta cells will go down. You can't do anything. So while you're having the diet, you have the exercise, you might also need to take medicines, which the doctor will tell you. If you do all that, you can have a long and healthy life. Today, if you see, I have posted on YouTube, Instagram, LinkedIn, Facebook. I've posted on all of them. I posted a picture of one of my 100-year-old patient. Yesterday was Varalakshmi Nom. So this man, after finishing the puja for his 90, you saw that? So 90-year-old wife just Sarada Katrar. He's tying the thread.
I saw that, and I also commented saying Kana Kandori Vendumna. I commented.
Okay. I'll see that.
And one thing I'm amazed is you're very active on social media. You're continuously raising awareness every single day. And I've been following your account for the past 1 week or 2 weeks now. And this is what I also discussed with my parents. Sir, regarding the you talked about the analytics, which means the data points.
Yeah.
So globally China, after China, India stands the largest.
Correct.
The population is also, evidently population is also one reason. And if you see highest prevalence in adults, there are some countries like Brazil, Middle East basically. So why is that? In the how do you see this divergent thing? Population jasti hai, but at the same time, only elderly are affected the most, as you said, 50%, and pre-diabetes 25%. Middle East la romba jasti hai.
Middle East, because of the socio-economic status. You see, they are the richest countries in the world. It's not US which is rich. See, US is a very diverse country. Very poor people are there. Large middle class is there. And then some rich people are there. In the Middle East, the population is very small. 1 million, 2 million. It's like chinna or Tinagar Mari or UAE. So that's all they have. All the Arabs are well taken care of. So they have basic, they're all quite rich. The Indians who have gone there are also well-to-do people. So what happens? The obesity rate is very high. They eat very rich food. They hardly have any time to exercise. So their obesity rates are very high. Because of that, the prevalence of diabetes is very high. If you see 25%, 30%, 35%, they have diabetes very, very high. We have a large rural population. 700 million people of India live in the villages. People hardly eat once or twice a day. They're so thin. There, the diabetes is just beginning to take off. The reason why China is ahead of us, number one, China's population is about 250 million more than India, number one. Number two is, China is much older than us. Very few children there. Very old people there. There's one child policy for 35 years. So there are hardly any children there. Above 80, 85 years, their population is very high. That's why the diabetes is very high. In 5 years' time, India is going to overtake China in population. You know that. China's population is going down. India's population is going up. So 2026, I think, 25 or 26, we're going to beat them. Once we become the largest country, by the time our people are also growing older, our lifespan is increasing, our obesity is in... China is a much richer country than India. Obesity is so much more. But the way we are going, even our rural poor are becoming fat now. Okay. Correct. So we are going to overtake China in 5 years' time. No doubt about it. So we are going to become the diabetes capital of the world, whether we like it or not. It's not something to be proud of. I'm not saying we'll get gold medal for that. We should not. But it's bound to happen. It's bound to happen. So we must be ready for it. We must be able to take all this diabetes prevention messages to the rural population, which is the reason why I started social media.
Oh, okay. So, how is the diagnostic works? So, for example, if an early adult, what are the diagnostics available to treat or to identify whether I'm diabetic or not? So, just because having some symptoms, I cannot conclude that. Definitely. So could you explain on that? Yeah.
So there are 4 tests. So the first one is called fasting blood sugar. Empty stomach la kaalaila elundirichu nama saapradhukku munadi test panni paakumbodhu 126 ku mela irundha. More than 126 milligrams in the fasting, you have diabetes. Number 2, the best test is called glucose tolerance test. We do GTT. We give 75 grams glucose. At the end of 2 hours, we draw one blood sample. It's more than 200. 200 ku mela irundha GTT la, then you are diabetic. There's a test called random blood sugar. Now we are sitting like this at any time, irrespective of the food, when we ate. We just do on random blood sugar. It's more than 200, you're diabetic. 4th is HbA1c test. That is 3 months average test. If that is above 6.5, that can be taken at any time. And it tells us last 3 months whether sugar is high or not. If that comes more than 6.5, இந்த HbA1c டெஸ்ட்ல 6.5க்கு மேல வந்ததுன்னா அப்போ சுகர் இருக்கு. ரேண்டம்ல 200க்கு மேல வந்தா சுகர் இருக்குன்னு சொல்ல போறோம். So any of these tests is enough. You don't need all the 4. Any one it is there, you are diabetic. So those are the diagnostic tests that we use. So
நீங்க சொல்லும்போது the glycometer is available. Generally, common man thinks whether ஒரு டவுட் எப்பவுமே இருக்கு மனசுல, ஒரு கிளைகோமீட்டர் ஒரு அக்யூரேட்டான ரிசல்ட்டை கொடுக்குதா இல்லையா அப்படிங்கிற ஒரு டவுட் வந்து எல்லாருக்குமே இருக்கு. சோ அத பத்தி கிளைகோமீட்டர்னுடைய
நீங்க வாட்ச் வேர் பண்றீங்களா?
எஸ்.
என்ன டைம் சொல்லுது?
இப்போ இல்ல 7:20 இப்போ என்னோட லேப்டாப்ல இருந்து பார்த்து சொல்றேன்.
லேப்டாப்ல பார்த்து என்னுடைய வாட்ச்ல 7:22ன்னு காட்டுது. ஓகே, எனக்கு தெரியும் 2 minutes ஃபாஸ்ட் தான். ப்ரோக்ராம் வரும்போது லேட் ஆகக்கூடாதுன்னு நான் 2 நிமிஷம் ஃபாஸ்டா வச்சிருப்பேன். சிலவங்க வந்து 15 நிமிஷம் ஃபாஸ்டா வைப்பாங்க, சிலவங்க 15 நிமிஷம் ஸ்லோவா வச்சிருப்பாங்க. வாட்ச் வந்து எந்த வாட்சா இருந்தாலும் தே வெரி ஹாப்பி. அதுல என்ன டைம் காட்டினாலும் தே நெவர் குவெஸ்டின். இந்த குளூக்கோமீட்டர்ல ஒரு 10 மில்லிகிராம் டிஃபரன்ஸ் வந்துச்சுன்னா போச்சு, தே வில் நாட் அக்செப்ட் இட். குளூக்கோமீட்டரும் லேபும் கம்பேர் பண்றது எப்படின்னு கேட்டீங்கன்னா, ஒரு காரும் ஒரு சைக்கிளும் கம்பேர் பண்ற மாதிரி. I'll tell you why. Because glucometer you're checking from here. This is capillary glucose. Lab la pogumbodhu take from here. This is vein. So capillary and vein, that you should not compare, number 1. Number 2, from the glucometer you're putting it straight onto the strip. So it's called whole blood. The blood you're not spinning it or any straight blood pot strip la pot you're seeing. Here you're taking and then you spin it with plasma you're checking. Okay. How can two be the same? Okay. So with all these differences, we don't expect it to be 100% same. Why we are having glucometer is as a life-saving thing. I'm sitting now and I'm talking to you. Suddenly I feel giddy. I'm a diabetic. Is it going low or is it going high? So suppose I have my glucometer with me. I put one drop in it. In 5 seconds, it tells me it's 50. 50, low sugar. I better go and eat. Suddenly you go and do. If you don't have this, how are you going to know? As you said, from symptoms, you cannot decide whether it's low or high. So glucometer is meant to give you a rough idea. It's not a gold standard, but still it's a life-saving thing. It will give you only 5-10 difference. See, if the glucometer is coming as 80, lab may say 90. What does it matter? If the glucometer is showing 80 and lab is showing 300, then you can throw away the glucometer. It doesn't happen that way. It's fairly good. About 5 milligram, 10 milligram difference will be there. But people are worried about, 5 milligram came, 10 milligram came. They worry. That's why I told about the watch, But the watch, half an hour difference comes also, they don't worry. That's why I want to tell you about that.
So it is a still 100% reliable instrument is what you're saying.
100%. Yeah. In fact, today I want to tell you, since you raised that and since latest things have come, today there is a small patch-like thing, which we are the first in the world to use it. Now it's very popular all over the world. A small coin-like thing. You put it on your hand like this. Just stick it like that on your hand. Okay? Carom board coin mari irukum. Just stick it on your hand. Adula irundhu vandu every minute it will measure the blood sugar without poking. Okay? Here, when you do this glucometer, you have to poke, and only at that time you will know what it is. And every time you have to poke, every time you pay for the strip, you have to pay. Here, you don't do anything. Just put it. It will continuously read the blood sugar. It will give you 100 blood sugars in a day for 14 days. 1,400 blood sugar it will give and give you all graph like this. So just now before this, I was having a webinar where I was talking on that time and range. So
it's a sensor works very similar to a Fitbit.
Something like that. It will tell you.
What is the name of it? You said patch.
It's called it's called AGP, ambulatory glucose profile and solluvom. AGP nu solluvom. Chinna sensor mari irukku. So if you put it, now we have started doing it for everyone. We tell every patient, you wear it at least for 2 weeks. We'll know how your pattern is. Based on that, we will adjust the sugar. You know why? One day the sugar will be low, tomorrow your sugar will be high. But we get an average of 2 weeks, you know where the pain point is, where it's going high. That alone we can correct. Unga breakfast la da neenga jaasti saapringa, so that we can reduce. Or idli korchirungo, then it will come down. Unga maatrai or 6 mani நேரம் முன்னாடி போட்டுங்க, அது சரியாயிடும். So like that we can, this is called fine tuning. This is also called precision diabetes. People ask me, நீங்க ஒரே ஒரு டிசீஸ் வச்சு 50 வருஷம் தள்ளிட்டீங்க, போர் அடிக்காதா உங்களுக்கு? போரே அடிக்காது. Why? Because every year we are bringing new things. We are going deeper. We have come to the stage where like precision diabetes. இப்போ இங்க இருந்து ஒரு இது அனுப்புறோம், நம்ம ஒரு ராக்கெட் அனுப்புறோம், நேரா போய் மார்ஸ்ல போய் அங்க ஒரு கரெக்டான இடத்துல போய் லேண்ட் ஆகுது. How is it possible? That is precision. Okay. இங்க இருந்து ஸ்கட் மிசைல் அனுப்பும்போது கரெக்டா போய் எனிமி இதுல போய் அடிக்கிறது. So அதே மாதிரி வந்து சுகருக்கு கூட we are able to do it today. After 50 years of research, we are able to do that. That is called precision diabetes. That is what we do and how it is different, how we are different from others.
Yeah. So அதனால people who are phobic பயமா இருக்கு இந்த லான்செட்டுக்கு பதிலா இப்போ ஒரு இன்ஸ்ட்ருமெண்ட் வந்திருக்கு அதுக்கும் இப்போ பயம் இருக்கு எல்லாருக்கும் அது போய் it will hit on the skin and then there will be a drop of blood which will ooze out. So அதுக்கும் இப்போ பயப்படுறவங்க yes AGP is there, use it, patch is there as
only sticking it, no blood, no, just stick it and it will start reading. Then you have to activate it, the sticker and then small reader is there, just show it like that, it will start reading. Then from there it will, you have switched it on, you know.
So you will also know throughout the day evlo irukku, throughout the day,
throughout the night, even when you are bathing you need not take it off. At the end of 2 weeks it will switch off. Then you take it out, see the entire reading. In between we want to see, just take the reader there. Oh, 120, okay, good. Anytime you can check without even poking, you know, see where science is.
That's a good advancement, doctor. So we'll take some questions here, doctor. Krishna Mohan, welcome. HbA1c is 6.7. Is it diabetic?
Yes, I just said 6.5 and above is diabetes. So Krishna Mohan, it looks like you know, there is a I mean it looks as we have diabetes, but the confirmatory test is always a GTT. So the HbA1c test is used to find out whether you're under control or not. Just for diagnosing that, although it's very simple. In India, I don't believe only in doing HbA1c for a diagnosis. HbA1c, after you're diagnosed, you use HbA1c every 3 months to see whether you're under control. GTT test is especially in borderline cases. Suppose HbA1c is 9, 10, then I don't need any other test. It's very high. Or a random sugar showed 300, then we know. But in these borderline cases, sometimes HbA1c will give a wrong result. So always better, for a lifelong, we're going to put a diagnosis of diabetes for you. So therefore, better to do it like that. Krishnaman has also asked, what medicines do you advise for newly diagnosed diabetes without destroying beta cell? Krishnaman, you know, I don't like these words like destroying beta cells and all that. Just now, another man wrote to me email. Just now I saw, doctor, you all of you give medicines which will destroy the beta cell. And the beta cell destroy பண்றதா 50 வருஷம் we have been working. You know, எல்லாரும் beta cell எல்லாம் அடிச்சு destroy பண்ணி எல்லாத்தையும் finish பண்ணி. We are not terrorists here, Krishna Mohan. We are trying to help you. And after 50 years, give us a little bit of credit for that. We have learned 50 years, you know, reading 1,000 books and after publishing 1,300 articles, which will destroy beta cell and which will not destroy beta cell. If I don't know, I shouldn't be in this field at all. I should have retired long ago. Okay. Definitely, I know a little bit more than the layman. At least that much credit you should give us. There are many, many medicines which will not destroy. Don't read all this, you know, social media stuff of all these quacks who come and talk to you and tell you destroy beta cell, destroy. I hear all this, I get so angry, you know. There is a reason why I got into social media. There's nobody to oppose that voice, you know. All people giving wrong information on that and misleading people. So there's no destruction of beta cells or anything. You use it judiciously. It's like a knife. I'll explain how it is. Romba sharp or knife has come now. Okay. You give it to some fool, he'll cut his hand and he'll cut everybody's hand and the blood will come and all that. You give it to a surgeon, plastic surgeon, he'll do precise surgery or a state of art he'll create, you know, the plastic surgery. It depends on who uses it. So who uses it? You give a Mercedes man, the fellow doesn't know how to driving, he'll go and bash up the Mercedes man. You give the Mercedes man to a fellow who's very good in driving, he'll take you so smoothly that if I'm having this glass, it won't even shake, you know. Which only no, nothing will spill in the glass. It depends on who is driving, who is doing it. So that is how it is.
I just got reminded of one Tamil quote long back. Marathil maraindadam maamada yaanai, marathai maraithadam maamada yaanai. When a carpenter and woodwork, ஒரு கார்பெண்டரும் I think the யானை பாகன் இவங்க ரெண்டு பேரும் ஒரு மரத்தை பார்க்கும்போது அதுல இருந்த ஒரு யானையுடைய ஓவியத்தை பத்தி பேசும்போது பாகனுக்கு வந்து அந்த மரத்துல இருக்கிற யானை தெரியுது.
ஆமா.
Whereas on the other hand, the carpenterக்கு அந்த மரத்தினுடைய அழகு தெரியுது. So இதுதான் I was just able to relate to it.
Exactly.
Yeah, coming back to another question. So நீங்க சொன்ன மாதிரி awareness session மாதிரியே நம்ம ஒரு myth busters பண்ணணும்னு நான் நினைக்கிறேன்.
Correct. I think we have to do.
People have a lot of doubts in their minds.
Correct. Absolutely.
So that is a major reason for non-compliance. And non-compliance naala diabetes control irukkuradhu.
See, till the social media came, I have nothing against social media. Social media is a very good tool and you have to think. The problem is any fellow can go and talk anything and that is there. And then people start sharing because that's what they want to hear, you know. If I say insulin கொடுத்து வந்து sugar வந்து குறைஞ்சதுன்னா எல்லாரும் தெரிஞ்ச விஷயம் தானே, அது என்ன பெரிய விஷயம். இன்சுலின் கொடுத்துட்டு அவங்களுக்கு டயபெட்டிஸ் வந்ததுன்னு ஏன்னா வந்து சொல்லலாம்னு வச்சுக்கலாம். இல்லை இன்சுலின் கொடுத்தா கேன்சர் வரும். அது வந்து ஷேர் பண்ணுவாங்க வாட்ஸ்அப்ல, அடி 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 எனக்கே வரும், சுத்தி 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 எனக்கே ஒரு 1000 பேர் வரும். ஓகே, அது ஒரு 1000 தடவை வந்த உடனே அது பிலீவ் பண்ணிடுறாங்க. பீப்புள் பிலீவ் இட். அதான் 10 பிரெயின் வாஷிங் தானே அது. ஸோ அது மறுபடியும் 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 வந்து 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 இன்சுலின் போட்டா கேன்சர் வரும், இன்சுலின் போட்டா, then they start believing it. So there must be a voice for somebody to come and say, வராதுங்க, நாங்க வந்து 50 வருஷமா யூஸ் பண்ணி ஒரு கேன்சர் கூட பார்த்தது இல்லை. அப்படியா? அப்பதான் தப்பா? ஓகே, அப்பதான் people are, because anybody can say anything and get away with it. That is a weakness of social. While the reach is very good, you can reach everyone, right messages must go.
Exactly, yeah.
Harm will be done to people.
The right message has to go, correct. So நீங்க glucose பத்தி சொன்னீங்க. When you were talking about the carbohydrates, protein and fat, you said fat and protein interim step இருக்கும், but carbohydrate directly gets converted to glucose னு சொன்னீங்க. So glucose னுடைய அளவு உடம்புல அதிகமானாலும் குறைஞ்சாலும் டயபெட்டிக் ஆவாங்க அப்படின்னு சொல்றீங்க.
டயபெட்டிக் இல்ல, லோ ஆனா வந்து ஹைப்போகிளைசிமியா, அது டயபெட்டிஸ் உடைய ஆப்போசிட். ஹையா போனா டயபெட்டிஸ். Low, usually that's called hypoglycemia. Low sugar is called hypoglycemia. Low sugar வந்து யூஷுவலா வந்து மருந்து எடுக்கிறவங்களுக்கு தான் வரும். மருந்து இன்சுலின் போட்டாச்சு, அவங்க சாப்பிட மறந்துட்டாங்க, லேட் ஆயிடுச்சு, அப்போ வந்து டிராப் ஆயிட்டே இருக்கும். தட் இஸ் காமனஸ்ட் காஸ். பட் சிலவங்களுக்கு அது இல்லாமலே வரலாம், அவங்க இன்சுலின் செக்ரேஷன் கொஞ்சம் அதிகமாயிடும். So because of that they can get hypoglycemia. But that also we can treat. Give little less carbohydrates, space out the food. So that's called spontaneous hypoglycemia. That can also occur. If that occurs, then you can adjust the diet and prevent it.
Okay. There is a question on metformin tablets. Is it something related to COVID? Metformin?
No. Metformin is a diabetic drug which is used for treatment. Deepa Satyanarayana's question you're asking, or Ilya?
No, this is Thangarajan Thomas.
Okay. What is he asking?
He's asking about the metformin's effect in the body, tablets, metformin.
I think somebody else also asked about insulin resistance. Can you explain? Selvaraj Pichapla, I'm getting also some questions here.
I'll not miss the questions. I'll ask you.
Can you explain insulin resistance? And okay. So insulin, see, there are two defects in diabetes. One is insulin secretion. The body doesn't secrete enough insulin. That is more pronounced in type 1 diabetes, where there is zero insulin. That is why without insulin you will die. If you have type 1 diabetes, don't take insulin. Any other pathy you can try, it will not work. Okay. If you only take insulin, you can survive, because zero insulin in the body. Without insulin, you cannot survive in the body. It's like not having water or air or something, oxygen. So it's like that. But the majority of patients have type 2 diabetes, where some insulin deficiency is there, but there is insulin resistance. That insulin which is coming is not working. So to make it work, one of the drugs which uses an insulin sensitizer, metformin, is a classical insulin sensitizer. It works in the liver. It will go and make the insulin get into the liver cells and burn off the glucose there. So that is how it is done. Insulin resistance also comes due to obesity, due to wrong diet, due to exercise. So if you exercise regularly, if you reduce your weight, your insulin resistance will come down. So in those people who are severely insulin resistant, going and giving them insulin or giving them some other tablet is not good. That is why we have to find out which type of diabetes you have. Is it the more resistant variety, or do you have the insulin deficient variety? And we have recently described 4 types of clusters of diabetes. So depending on that, we will give the treatment appropriately. Then Deepa Satyanarayana is asking, does metformin cause digestion problem, stomach problem? If we give it in high doses, yes, some people can. Metformin, one of the side effects is a little indigestion, and about 90-95% of patients can tolerate a reasonable dose. If you keep increasing the dose, sometimes it will go. But there are about 5% of patients, they cannot take any metformin. They take even smallest dose of metformin, they'll have diarrhea. Those people, you cannot give metformin. You'll have to stop it and give something else. There is another question.
What is DKA? Can you explain DKA?
DKA. DKA is diabetic ketoacidosis. It is when the sugar goes very high, you get diabetic ketoacidosis. Blood sugar goes, normal I said is about 120, 130, 140. About 200 is diabetes. If you become 500, 600, 800, like that, then the body cannot utilize the glucose. It gets converted into fat. That will get converted into what we call as ketone bodies, and then you go into a coma. So diabetic ketoacidosis occurs very commonly in type 1 patients and children and so on, but can also occur in adults when you have infection, when you have COVID-like thing, those kind of things produce DKA. At that time, you have to give insulin every hour and then bring the patient back to normal, and give a lot of fluids. By giving all that, decay, you should not go into decay. If you go to decay also, you can treat it and save the life if they come early. If you come very late, when the brain is already damaged and all that, we unfortunately lose some patients. We should not lose a single patient due to decay. Nobody should develop decay. If they're actually trained, properly educated, nobody should even develop decay. There's one question, Hari Raghotman. Sir, country to country sugar levels change due to habits and environment. How can a single value for all countries be possible? It's a good question. But just because you eat chapati here and somebody eats pizza there, I cannot keep changing all your blood sugar values for that. No. Suppose tomorrow you eat pizza, again I'll change your blood sugar back. Okay. And tomorrow you drink a Coke, so again I'll change your blood sugar back. See, today it's all globalized. Where is the diet? They're also eating dosa. You go to New York, you can eat dosa there. You go to, Saravana Bhavan is so popular in Delhi. Inga vanda poha saapran, idu saapran. It's all globalized now. There is no more all these diet changes and all that. One fellow exercises more, you cannot lower his sugar. See, there is something called normal. Why are we having temperature fixed for everyone? 98.4 degrees. Yeah, India 100 வைக்கலாமே. 100 வந்தாதான் temperature வரும்னு சொல்லிட்டு. Blood pressure கூட மாத்தலாமே. இங்க 200 வந்தாதான் BP. அமெரிக்கால 120 வந்தா BP. See, there is something called normal variation of human body. Blood sugar, blood cholesterol, blood pressure, temperature. These are all normal things for a human being. Just because our color is brown and we are eating rice, our thing that we don't become a turtle or a tortoise or something. We are also human beings only. We are very close. In fact, our monkey cousins are 99.5% like us. You may know that there's only 0.5% difference between a chimpanzee and a human being. 99.5 is same. That much only evolution has taken, only 0.5%. And the 0.5% completely mari pochu. We stood upright, we started walking on two legs. Adala the 0.5% difference da. Okay. So between human beings, yes, there is some difference. For example, for obesity, we don't use the huge American obesity cut point because we're all very thin. So we use slightly different cut point based on years of research. But for glucose, we have not found that difference at all. We are doing tests in the same way as they do in Germany or US or Japan or US. Same laboratory method, same thing we are doing. When we do the normal population, when we do epidemiology, it's called normal population when you study. When we study and look at the blood sugar profile, it's exactly the same. Whether it's in US or Germany or India, whether it's in Delhi or Madras, Chennai, there is no difference in the blood sugar level. So there's no need to put different cut points for different countries. Because if that is so, today I'll have diabetes here. If I take a flight and go to US, I'm not diabetic because now I'm in US, So there'll be total confusion. How do you set guidelines? That is the reason why we take different.
So my father is diabetic. Another question, my father is diabetic and he gets tired and weakness. I think she is talking about the side effects. So what are the effects of diabetes? And how do we handle that?
I'll talk about symptoms as well as I'll talk about the side effects. Both are symptoms of arigurigal. What are the symptoms of diabetes? First of all, remember, diabetes is a silent disease. 50% of people don't have any symptoms at all. 50% don't have any symptoms at all. Then you'll say, how will you find out if you don't have symptoms? That is why it's called silent killer. Sugar, BP, cholesterol, and even early stages of cancer don't have any symptoms. It'll be growing inside your body and you will not even know till it is too late. By the time the symptoms come, it is already late. So then how do you find out? That is why an annual checkup is recommended. After 30, 40, you go and have an annual checkup. Suddenly you'll find the sugar going up. Somebody asked about pre-diabetes. Can you catch the stage of pre-diabetes? So first there's a normal stage, normal glucose tolerance. Then there's a pre-diabetic stage. Then there's a diabetic stage. If you catch it in the last year it was in the normal stage. Today you come to pre-diabetic stage. Oh, it's progressing. Let me immediately lose some weight. I'm going to set myself target. 5 kg in the next 2 months I'm going to lose. I'm going to go on diet. I'm going to exercise. You can bring it back normal. You don't even need medicine. You don't check this year, next year. Suddenly one day you will find 300 blood sugar. 4 years ago it was normal. Yes, in 4 years you progressed slowly. Unfortunately, you missed the bus. Now, by the time your beta cell function has gone down, your pancreas stopped working, then only you found out fault is yours. You missed it. Had you gone earlier, you could have done it earlier. In early stages, it is reversible. Yes, even in early stages, reversible. But you then wait for another 5 years, another 10 years, and again, beta cell function is going down, 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 down. All the complications have come. You asked about complication. It can affect the eye, can affect the kidney, siruniragam, kangal, sirunirgal, irudayam, heart, nerves, blood vessels, feet. These are all the major brain. These are the major organs which get affected due to diabetes. In fact, they say it can affect from the head to the foot, including the head and including the foot. You know, that is how diabetes comes. No organ it spares. Every disease is made worse. If you have TB, it will become worse. If you have diabetes. If you have COVID, it will become worse. Today in the Hindu, there was an article about the Tamil Nadu data, where comorbidities we call it. Okay, yes. If you have diabetes, hypertension, heart disease, they are the people who are dying due to COVID. Older people, diabetic, hypertension, heart disease, respiratory disease, lung disease. These are people, asthma. These are the people who don't do well. But the good news is, I've also been quoted in that in today's Hindu. So if you keep your sugar under control, your immunity improves that much that you get the same benefit like a non-diabetic person. So what's the moral of the story? Moral of the story is keep your sugar under control, keep your BP under control, keep your cholesterol under control, have a checkup and have a regulated diet. I talked about immunity. So one word about immunity, I'll just talk. People think immunity is like, oh, take one B complex, you know, take one zinc capsule, take one vitamin C capsule, then I'll become immune. Immunity is not so simple. Immunity depends on whether you sleep well, okay, whether you exercise well, whether you're reducing your weight, whether you're eating good, healthy food, vegetables, salads, protein, whether you are reducing your stress through yoga, pranayama, you're reducing your stress levels in your body, okay, and finally controlling all these chronic conditions like diabetes and so on. If you do this, your immunity is 100%. COVID will come and it will just go off like that. It cannot even enter you because your body is so strong. You would have heard 80% of COVID people don't have any symptoms. Asymptomatic. How many times you read in the paper? Why? Because their immunity is so good, COVID is not able to come in at all. It will come, can't do anything, it will run away. Okay. If you are a weak person, COVID will come and hit you. And that weakness is if you have uncontrolled diabetes, you are not eating properly, you are not sleeping properly. So immunity cannot be bought by over the shelf. You know, you take our kashayam sapta immunity, you know. Oh no, you take the kashayam, but in addition you must do all these other things. Appada unga immunity vandu improve agum. Okay, you cannot get buy immunity in a pharmacy la poi vaanga mudiyadhu. Immunity, it's something which you have to do yourself. Okay.
Yeah. So another question. I think there are a couple of questions about fruits to eat. That comes under the diet element. Okay.
So fruits வந்து சாப்பிட கூடாதுன்னு இல்ல. You can, if a diabetic patient can also take fruits. But fruits எடுக்கும்போது there are low glycemic index, high glycemic index. So sugar நிறைய ஏத்தக்கூடியதும் sugar அவ்வளவு ஏறாதுன்றதும். So low glycemic index is apple, orange, guava, papaya. இதெல்லாம் சாப்பிட்டீங்கன்னா அவ்வளவு ஏறாது. If you take others like mango, jackfruit, grapes எல்லாம் சாப்பிட்டீங்கன்னா டக்குன்னு sugar வந்து ஏறதுக்கு சான்ஸ் இருக்கு. So we will say that. So உடனே வந்து சோஷியல் மீடியால somebody will come and say, மாம்பழம் சாப்பிட்டேன், ஒன்னா டாக்டர் சொல்லுவாரு சாப்பிடக்கூடாதுன்னு யாரும் சொல்லல. கொஞ்சம் கம்மியா சாப்பிடுங்க. மாம்பழம் சாப்பிட்டா கொஞ்சம் ரைஸை குறைச்சுக்குங்க. சாப்பிடக்கூடாதுன்னு இல்லை. மாம்பழம் is also fruit. It's not a poison. Okay. Potassium cyanide கிடையாது அது. It is mango. It is good. It contains so many nutrients. Banana, அதுல நிறைய பொட்டாசியம் இருக்கு. பிபி குறையும். Banana is very good. But banana ஒரு 100 கேலரி இருக்குன்றது யாருக்கும் தெரியலையே. அதுல சுகர் இருக்குன்னு யாரும் தெரியலையே. So suppose you are taking எல்லாம் நிறைய ரைஸ் எல்லாம் சாப்பிட்டதுக்கு அப்புறம் ஒரு பனானாவும் சாப்பிட்டு எல்லாம் சாப்பிட்டீங்கன்னா உங்க கார்போஹைட்ரேட் வந்து எங்கேயோ போயிடும், உங்க சுகர் வந்து ரைஸ் ஆயிடும். So you must be careful about what you take தவிர there is no at all. For example, somebody is asking Ratnavelu Kumar Pandyan Ratnavelu, come to that. Type 1 diabetes very பேசுறாரு. சைல்டுக்கு டயபிட்டிஸ் வந்துச்சு. அப்ப நம்ம லைஃப்ல ஒரு ஸ்வீட் கூட சாப்பிடக்கூடாதா? யாரும் சொன்னாங்க சாப்பிடக்கூடாதுன்னு? வாரத்துல ஒரு தடவை let them have a little sweet. இல்லைன்னா சைல்டு சைக்கலாஜிக்கலி மேட் ஆயிடும். பிகாஸ் எல்லாரும் ஸ்வீட் சாப்பிடக்கூடாது குழந்தை வந்து ஏதோ சம்திங் அப்நார்மல் ஹியூமன் பீயிங் நினைச்சுக்கோம். ஓகே, 6 days சாப்பிட வேண்டாம். 7th day இல்லைன்னா சைல்டு பர்த்டே வருது, கிவ் அ லிட்டில் ஸ்வீட், let the child take little bit. அன்னைக்கு கொஞ்சம் ரைஸ் கொஞ்சம் குறைச்சிருங்க, 2 யூனிட் இன்சுலின் ஒண்ணா ஏத்திங்க. Do something, adjust and go. There is nothing we are saying you should not do in life. லைஃப்ல எல்லாமே பண்ணலாம். ஓகே, nothing you should not do. எல்லாம் கொஞ்சம் ஒரு லிமிட் வச்சு பார்த்துட்டா then it will be okay. So Ratnavel is asking a question. Type 1 diabetes curable illa lifelong insulin podnuma? Type 1 diabetes in solradha I just now told you. The amount of insulin in the body is zero. ஒண்ணுமே கிடையாது. அப்படி இருக்கும்போது insulin cannot be replaced by a tablet. Insulin cannot be replaced by diet. Insulin cannot சொல்றோம் பிளான்ட் சாப்பிட்டா அதுல இன்சுலின் வரும். ப்ரொடியூஸ் பண்ணிட்டுமே, இன்சுலின் ப்ரொடியூஸ் பண்ணிட்டு let's get a new method of producing insulin if that is true. Okay, they're all fake news. It's not true. ஸோ இன்சுலின் திடீர்னு நின்று போயிடுச்சுன்னா, ஃபார் அ சைல்ட் சடன்லி இன்சுலின் வந்து 0க்கு போயிடுச்சுன்னா இன்சுலின் வந்து இன்ஜெக்ட் பண்ணி தான் ஆகணும். இன்ஜெக்ஷன் பண்றது ஐயோ அது பெரிய, வை யூர் இன்ஜெக்டிங், இட்ஸ் அ ஹார்மோன். தட் இன்சுலின் இஃப் யூ ட்ரிங்க் இட் லைக் அ ப்ரோட்டீன், வயர்ல வந்து ஹைட்ரோக்ளோரிக் ஆசிட் இருக்கு, அது அப்படியே டிஸ்ட்ராய் பண்ணிடும் இன்சுலின். ஸோ இட் cannot get absorbed. For many years we are trying. அது எப்படி ஒரு கேப்சூல்ல போட்டு அந்த ஹைட்ரோக்ளோரிக் ஆசிட்ல டேமேஜ் ஆகாம அது இன்டெஸ்டைன் வரலும் வச்சுட்டா சரியாயிடுமா? Almost succeeded. Biocon company in India almost succeeded 2 years. I am on their advisory board. I am helping them with that. Failure ஆயிடுச்சு. Then again we tried. Second time after 2 years. Again we failed. Novo company which makes insulin, அவங்க ட்ரை பண்ணாங்க last year. They almost came with it. Then they found the amount you have to take of that, அவ்வளோ சாப்பிடணும், which is not commercially viable. அதனால again they failed. We're not given up. We're still trying. நேசலா ட்ரை பண்ண முடியுமா, ஸ்ப்ரேயா ட்ரை பண்ண முடியுமா, எல்லாம் ட்ரை பண்றோம். இப்போதைக்கு ஒண்ணுமே வரல. அதனால you have to inject yourself. Once you inject, from there into the blood, it will get absorbed and it will go and inject. Now, why I am saying about this is, insulin was discovered on July 30th, 1921. Today we are on August 1st. 2 days only has crossed. July 30th, 1921. 99 years cross ஆயிடுச்சு. Next year, July 30th, வரும்போது 100th anniversary of insulin. Till insulin was discovered in 1921 by Banting and Best in Toronto. I have been there to the place where Banting and Best worked, where Banting இது அந்த லேப் எல்லாம் போய் பார்த்துருக்காங்க. அவர் பண்ண இன்ஸ்ட்ருமெண்ட், அவர் போட்ட கண்ணாடி கூட வச்சிருக்காங்க. I've gone and seen that in Toronto. Okay, so அங்க வந்து when before Banting and Best the discover பண்ணி insulin July 30th 1921ல கண்டுபிடிக்கிறதுக்கு முன்னாடி, if a child got type 1 diabetes, அப்போ இருந்தது type 1 diabetes, எத்தனையோ hundreds of years type 1 diabetes, 3 months 3 மாசத்துல செத்து போயிடும் child. 6 மாசம் வெரி ரேர். 1 year is unheard of. யாரும் 1 year live பண்ணது. இன்சுலின் 1921ல கண்டுபிடிச்சாங்க, 22ல அதை பப்ளிஷ் பண்ணாங்க, 23ல நோபல் பிரைஸ் கொடுத்துட்டாங்க அதுக்கு. Because they realize it's such an important. இவ்வளவு ஃபாஸ்டா நோபல் பிரைஸ் யாரும் கொடுத்தது இல்ல. அதுல பண்ண ஒருத்த சர்ஜன் Banting, he had nothing to do with diabetes, spelling கூட தெரியாது அவனுக்கு. When he wrote in his book, he misspelled diabetes. அவன் தான் கண்டுபிடிச்சது கியூர். இன்னொருத்த ஸ்டூடெண்ட் பெஸ்ட், அவன் ஒரு காயின் டாஸ் பண்ணி யாரு ஹெல்ப் பண்ணணும்னு தெரியணும், ஒரு காயின் டாஸ் பண்ணி we won the coin toss, அப்படி அவனுக்கு நோபல் பிரைஸும் கிடைச்சது. ஓகே, தட் பாய். சோ எதுக்கு சொல்ல வரேன்னா, டுடே 1921ல கண்டுபிடிச்சிட்டு 90 வயசு இருந்தவங்க இருக்காங்க, 90-95 வயசு வரலாம் இன்சுலின் போட்டு இருக்கிறவங்க இருந்திருக்காங்க. 3 months to 90 years, 95 years diabetes. That is insulin. அப்படி என்பது விளையாடக்கூடாது. அந்த மாதிரி ஒரு லைஃப் சேவிங் இது இருக்கும்போது அதை போய் வேண்டாம், நான் ஒரு லேகியம் கொடுக்குறேன், நான் ஒரு இலை கொடுக்குறேன், டைப் 1, எத்தனையோ பேர் செத்து போயிட்டாங்க. அந்த மாதிரி my children whom we have been treating with type 1 diabetes, எவனோ ஒருத்தன் ஏமாத்திட்டு இந்த இது நாட்டு மருந்து சாப்பிட்டு சரியாயிடும், நாட்டு மருந்து சாப்பிட்டா அவ்வளவுதான் காலி, fellows dead. ஓகே, ஸோ குழந்தைங்களுக்கு டைப் 1 diabetes எல்லாம் விளையாடக்கூடாது. டைப் 2 diabetesல அதெல்லாம் you can try all that. டைப் 1க்கு பண்ணவே கூடாது. So to answer your question, Kumarapandian, it is lifelong, but we can give it in pen மூலமா கொடுக்கலாம், பம்பு மூலமா கொடுக்கலாம், ஸ்டெம் செல்ஸ் வரப்போகுது ஃபியூச்சர்ல கண்டுபிடிக்கிறதுக்கு. பட் ரைட் நவ் இட் இஸ் இன்சுலின் only. Without insulin we cannot live with type 1 diabetes.
No wonder. Seems like a number one disease, sir, diabetes. The amount of questions that I'm getting is, it stands a testimony to that fact. So the next question, Deepa Satyanarayana, after recovering from DKA, can one plan for a pregnancy?
Yes, definitely, Deepa. Why not? First of all, it looks as if somebody you know or you yourself, somebody has had it, it looks like. Type 1 diabetes, only people, they only get DKA, but after DKA, the episode is over. If you look after it, why did DKA come? That answers my question. That person would have stopped insulin or something, that's why DKA came. Now, if you stop, if you continue and keep your sugars under good control, you can have a normal life. Okay. I am going to interview in my Facebook Live series in the next few weeks. I am interviewing many people who had type 1 diabetes when they were 2 years old, 3 years old. Later they grew up, they got married, they got pregnant, they got children. The children grew up, then the children got married, and these people are still continuing insulin. Okay, so they can have their full life. They can also get pregnant, they can also have children. In fact, I think in 2 weeks from now, I'm going to interview a very well-known person with type 1 diabetes. She has 2 children, 2 boys she has. Both pregnancies, I was fortunate to help her to go through, and she has gone through. She's perfectly well. Even now, she's continuing insulin. The boys have grown up, but she's fine. So normal life is possible with diabetes, even if it is type 1 diabetes.
Another question from Kishore. Lantus 50 I'm taking. Any other insulin available for weight loss?
Insulin is not available for weight loss. In fact, insulin increases the weight. That is one of the problems with insulin, is that it increases your weight because a hormone. You're injecting a hormone, so normally there is weight gain. In type 1 diabetes, there is no other treatment. So you have to continue only the insulin. You have to exercise, eat little less, and type 1 patients don't put on that much. They are already thin. They don't put on. Type 2 diabetes, if you're taking 50 units of insulin, I presume you have type 1 diabetes, type 2 diabetes. There are so many tablets today which can help you reduce weight. SGLT2 inhibitors are there. Metformin is there. There are many GLP-1 receptor analogs are there. They can help you to lose a lot of weight. With that, the insulin dose can be cut down, and many people can even stop the insulin completely by adding tablets. So very many new tablets have come which can have very good effect on weight loss. They become remarkable drugs. In fact, right now research is going on. Maybe next year it will come on an oral tablet. If you just take that, you will lose 10-15 kilos, just like doing bariatric surgery. For really overweight people, these are all very big boon. So we can do that.
So another question is, there's a lengthy question. Pre-diabetic with HbA1c 5.8 to 6.1, and it goes on FBS. I think he has given some numbers there, sir, for you. BMI is around 27. And then what else he needs? Diet and lifestyle modification. Any anti-diabetic drug is needed? If anything, when to start the drug? Is the question from Mr. Sanyal.
Mr. Sanyal, pre-diabetes 5.8 to 6.1 is pre-diabetes. Lifestyle is very important in pre-diabetes. So diet, exercise, yoga, losing weight, that will be the first step, and that's the most effective in the stage of pre-diabetes. Sometimes if it is not enough, despite that HbA1c is still rising, it's not coming down, that means the beta cells are going down. That time we start treatment. Normally we give metformin, but small dose of other drugs can also be considered. But normally pre-diabetes stage, we don't give tablets, we give only diet and exercise, and they do really well. So it looks as if weight is the main problem. Once you tackle your weight problem, it will definitely, your sugar will come down, your HbA1c will come down. You can have remarkable complete reversal of diabetes in that early stage. It's only after the late stages that reversal becomes difficult. In early stages, it is very, very difficult. Dr. Jalaja Ramesh has written, excellent motivation, positive vibes for diabetes pregnancy. Sir, thank you, Jalaja. I know you treat a lot of people with pregnancy diabetes, and I think you're a good role model that how well you treat your diabetes. And I'm sure you'll agree with me, Jalaja, that many of your pregnant women have had normal weight children and have been completely normal. So every person with diabetes who's considering pregnancy, it's a good thing. Deepa is asking, thyroid cause diabetes. Thyroid doesn't cause diabetes, but it is commonly associated with diabetes. So those who have diabetes, about 30% have thyroid problems. Also, those who have thyroid problem, 30% have diabetes. But thyroid directly does not cause diabetes.
Yeah, and the children will invariably have type 1 if the mother had one. Okay, she's asking about the genetic.
Type 1, will the children get it if the, what is the question?
Yes, that's the question. Yes, yes.
If the mother has it, children have it. So I told you about the the person I'm going to interview, in the coming weeks. Both the children are not type 1 diabetic. There is another, not another, I have hundreds of such people who have got married and their children don't get it. But one thing I want to tell you when we talk in a public forum like this, one thing you must remember, and that's what makes this so interesting for us as a researcher. See, if I ask you in mathematics, what is 2 plus 2? There's only one answer. It is 4, isn't it? In biology, if you ask that, what is 2 plus 2? It's very rarely 4. Can you believe that? It can be 3.5. It can be 4. It can be 4.5 also. Because some people have more effects, some have less effects, some have normal effects, some have. This is a human body. It varies so much from. That's why we have a normal range. We don't say blood sugar is 80 is normal. We say 80 to 120. That much range. Some will have 80, some will have 120. But you have 200 is definitely diabetes only. If you have 50, it is very low only. But within that range, there is a range. For everything there is a range. For BP there's a range. For sugar there's a range. For thyroid there is a range. For everything there is a range. You'll never find a biological value given as 1 point. It will be a value, a range given. So that is that human variation. That is the reason why we cannot give the one treatment for every diabetic. Each patient is different. And so we will read everything in the books, but we don't apply it when we come to the patient. To that patient, all that knowledge is used, and the patient sitting in front of me, we will decide what is to be taken for that particular. Because that patient can be very different from the previous patient whom I saw, will be very different. Okay. So why I'm saying that is because, sometimes in a family, there are 3 children. So the first one would have got type 1 diabetes. So the mother and father will be very anxious and they'll ask, will the other 2 children get? And I'll say 95% they will not get. And 95% of the time will be correct also. But I've had families where after 1 year, they'll say, doctor, you said you won't get. Now my second child has got. Will the third child get? Varadunga, 100% varadunga. Be confident. After another year, that is biology. That is biology. You cannot say anything 100% adichu solla mudiyadhu. Adichu solla mudiyadhu. Anything can happen. Any variation can occur. At the same time, if you take 100 such children, only 4 or 5 may get type 1 diabetes if one sibling has it. 95 will not get. But that 5, how do you know who is in that 5? Very difficult to say. Of course, a lot of research you may be able to predict. If you do genetic test, somebody asked, can you do genetic test to predict? I think you asked me earlier. Can you do genetic test to predict diabetes? You can. You can for certain types of diabetes. I mentioned in the beginning, I mentioned about types of diabetes. I said neonatal diabetes, MODY, mature gestation. That you can do clearly. This person will get it. You can even say at which age they'll get it. But in the common garden type of variety that we say, genetic stage has not yet come. But for finding out who will get diabetes in a population, suppose in Chennai, you want me to tell who will get diabetes. Without drawing 1 drop of blood, I can tell you with about 75% accuracy who is likely to get diabetes. You know what I ask? What is your age? Does your father and mother have diabetes? What is your waist circumference with an inch tape, Taylor's inch tape? And do you do exercise or not? That's all. 3 questions and 1 waist measurement. With 75% accuracy, without drawing 1 blood, I can tell you who will get diabetes. But only 75%. The 25% always will go wrong because biology is never 100%. 70% podume. Those 70% you can concentrate on. Those 70% you can tell them reduce your weight and all that. They can prevent diabetes. The other 25% you cannot.
So genetic proactiva will be able to prevent
because
that.
You see, or gun edta bullet illana you cannot pull the trigger. But bullet ulla potittu gun la potu neenga cupboard la lock panni vechita it will never shoot. Need the gun, you need the bullet, you have to put the bullet inside, then you have to pull the trigger also. The bullet is a genetic factor. Okay, the trigger, environmental factor, is the other factors. Overweight, stress, exercise illana, wrong diet, okay, infections when they work, you don't treat it. These are all the side things which you call as environmental factors. That is what pulls the trigger. But the basic factor is the gundu, which has gone inside the bullet. That is the genetics which you inherit from your parents. So if you have the gene also, by doing a lot of exercise, you can prevent it. Why should you get it? Why should you wait till you get it? You can prevent it.
There is another question on the relation between obesity and diabetes, the high LDL and low LDL. I think you've already touched on those, but if you would like to answer, you can go ahead.
Yeah. So obesity and diabetes have a parallel relationship. So as the obesity goes up, your diabetes also goes up. So in a society, that is why, see, in 1971, in Chennai, only 2% had diabetes. Today in Chennai, if you take all people in Chennai, adults above 20 years, it was 2% in 1970. Today it's 25%. Why did it happen? Main reason is obesity increased. When we were in school, I don't know, we in Solomon, I'm not as young as you. When I was in school, in the whole school there'll be 1 fat boy. Okay, on the fatty in Kubdon, and the whole school la onno rendo irukum. If every class has 20 fat children, okay. That is the range. Do you agree with me? If you see your generation and now you see the present generation, you will see how much more obesity has come. And the obesity obesity is equal to insulin resistance. So insulin is not working. So your pancreas will overwork and it will go off soon. If you have a genetic factor also, father, mother having, it will get converted into diabetes. That is why GDM, which our Jalaja Ramesh also asked about, gestational diabetes also was only 2% about 20 years ago. Today, 25%. What does it mean? If 100 pregnant women are there, 100 pregnant women in Chennai are there, 25 will have diabetes. Can you believe it? 1 out of 4 pregnant women have gestational diabetes because the weight of those women has gone up so much. Earlier, the woman would have been 50 kilos. Today, average woman is 70 kilos, 75 kilos. So that is producing the diabetes. You have family history also, kandipa varum when you have. But again, knowing that, now she's going to get, married. Next 6 months, she loses 10 kilos, 20 kilos in weight. Then when she gets pregnant, she doesn't get diabetes. So it's so easily preventable. If only you know and you take action against it.
So it has to be managed.
Correct. Prevented, managed. The one thing is, there are certain, you take certain cancers. Okay. I'm nothing against cancer and all, but I'm just saying there are many cancers which you can do nothing to prevent. You don't even know why it comes. Steve Jobs died due to a pancreatic cancer. He had all the resources he had. He could not prevent it. He could not even prolong his life. So cancers are like that. Before we know, it is already spread. We come to know. There is no early stage you can go. Of course, certain things you can stop smoking, stop this, and the many you can do. Onnum but smoke life la oru smoke pannadavungalukku lung cancer varudhu. What do you do? How will you prevent it? How could you have prevented it? You tell me. Diabetes is not like that. You know early stage, pre-diabetic stage, diabetic stage. You know how it is going to go. You know weight triggers it. So much of opportunity, nature has given you. If you only take that and then follow it into action, we can. I said now we're going to overtake China. If today I'm telling you, if every Indian starts exercising right from school, we start and don't bring in obesity, reduce obesity in school. We make physical activity compulsory in schools. We make our nation a fit nation. Apdiye diabetes will start going down. India will update koranjirum. That's what you're waiting for. In fact, one of my teachers used to ask me, prevention diabetes diabetes sir, now where are the specialty sir? Cure I've done enough in my lifetime. Then I'll change specialty. Now where are the I'll go to that. Serious prevent sir, serious really seriously I want diabetes to come down.
எல்லாருக்குமே the cure பண்ண முடியுமாங்கற கேள்வி தான் எல்லார மைண்ட்லயே இருக்கு. That is what is evident. You are saying it is manageable because it is internal. It's a hormone related. So it is not a disease. It does not come from outside.
Disorder.
So it's a disorder.
Diabetes is not a disease. My father was the first in India. He used to say diabetes is not a disease, it's a disorder. One more thing he used to say, I used to argue with him. Now I know he was right. அப்ப சொல்லுவாரு, கொஞ்சம் டயபெட்டிஸ் இருந்தா நல்லதுப்பா. என்னமா சும்மா சொல்றேன், பிராக்டிஸ்க்காக சொல்றியா நீ? என்ன சரி இல்லப்பா, கொஞ்சம் டயபெட்டிஸ் இருந்தா, if you have diabetes, you will go to a doctor, you will check up, you will start eating healthy, you will start exercising, you won't smoke, you will do yoga, you will reduce your thing, you will go for frequent checkups, so you'll get some picked up. I don't have diabetes, why should I go to a doctor? What's the motivation to go to a doctor? Apdiye irundhu certain diseases will become very, the number of early cancers we pick up in our hospital, they don't come to me for cancer, they come to me for diabetes. I'll do an ultrasound to see the fatty liver and adula or chinna tumor kidney la pick up panna. Okay, because he came for his checkup, because we did this particular test, we nera abdi person comes to adutha varame the kidney tumor is removed, is cured. How many such cancers we have cured because in the early stages we looked for it and we found it. So if he was not diabetic, he probably would not have come at all, because we tell them come on every 3 months, every 6 months you come. We recommend that a diabetic patient comes to a diabetic clinic at least 3 to 4 times in a year, and once a year a complete checkup is done. When we say that, people think we are doing this to make money. No, it is detect disease early. It is for you that we are doing. If we pick it up early, we can cure. You don't want us to do, okay, you don't do. Tomorrow if you develop any complication, don't blame us. That time, they'll go to another hospital and they'll ask, ஒரு blood test கூட பண்ணலையா, ஒரு ஹீமோகிராம் கூட பண்ணலையா, ஒரு liver function கூட பண்ணலையா, பண்ண வேண்டாம்னு சொல்ல போறோம். we ask him, no, idukalla edukku sugar matram paatha podum enakku, if you do that, prevention is better than cure. We should not be penny wise and pound foolish. இப்போ போய் why do we take insurance? காருக்கு எதுக்கு இன்சூரன்ஸ் எடுக்கிறோம்? இன்சூரன்ஸ் ஆக்சிடென்ட் வந்தா பாத்துக்கலாம். அப்படி பண்றது இல்லைல்ல. ஒரு 2000 ரூபாய் இன்சூரன்ஸ் எடுத்துட்டா 1 லட்சத்துக்கு டேமேஜ் வந்தா they will pay. அதுக்காக தான் we are giving it, இல்லையா? அதே மாதிரி தான் மெடிக்கல் இன்சூரன்ஸும் அதே மாதிரி தான் செக்அப் ஃபார் டயபிட்டிஸ்.
கண்டிப்பா ரொம்ப நல்லா சொன்னீங்க சார். Control fluctuation while taking insulin. How to control the fluctuation when taking insulin?
That can be done in many ways. One is by adjusting the diet. When you take an insulin, you know that the sugar can go low. That is one fluctuation. When does it go low? When you are supposed to eat at 12:31, but you eat at 3 o'clock. It will definitely go low. Then you overeat, it will go very high. There is a fluctuation. If you eat on time, then the low would not have come. Then you will not overeat, it will not go high. So by diet, you can do that. Number 2, you are finding a particular pattern. Evening, in the evening, you walk a little bit. Then that fluctuation can be reduced. Night, low up. Night, insulin, then you don't get into low sugar. Have another snack before you go to bed. Then you can prevent the low sugar. Everything in life is fixable. If you find the solution for it, I talked about this AGP, this patch. Once you put it, you can easily find out where it's going high, where it's going low, where it's going easy as a fix panidla. Okay. To do it blindly without doing anything, then I must do astrology work only. Astrologer paathitte eppadi insulin kudukrona astrology paathitte pannanom. You're doing it scientifically. It's so easy to do it.
Sir, we have almost come to the end of the program. If you would like to take 5 minutes, I'm okay with it.
No problem.
I would like to ask the other question. You said there are several stages in diabetes. The initial stage and the pre-diabetic stage and diabetes stage. Treatment procedure liyum every stage வந்து நம்ம வந்து மேனேஜ் பண்றதுக்கு ட்ரீட்மென்ட்லயும் ஸ்டேஜஸ் இருக்கா? அப்படி இருக்குன்னா அது என்ன?
கண்டிப்பா. So normal diabetic, normal stageல பாத்தீங்கன்னா only diet and some weight reduction or prevention of weight gain, that is enough at that stage. Pre-diabetic stage, you'll have to intensify it a little bit more, set your targets, reduce it, then you can reverse. Early stage of diabetes, maybe 1 tablet with some diet, exercise will be enough. You go to the next stage, you may need 2 or 3 tablets, only then it will control well. You might start needing insulin. Another 5-10 years down the line, you may definitely need insulin, otherwise the sugars may not get under control. Okay, but that also can be done. If you really very strict, you may even go off insulin. Then comes a stage of complications. Your kidney is affected now. Once the kidney is affected, 50% of the medicines cannot be given. They are contraindicated. Then you will have to change the treatment completely based on your kidney. If your nerves are affected, then for that you have to give the treatment. That's a late stage of the disease. One should not go into that late stage at all. I mentioned about that 100-year man today who tied that thing. He doesn't have any complications. He's crossed 100 years. Similarly, we had Professor Chittibabu. He unfortunately died after reaching almost 101 years. He died. But he had Professor Chittibabu was, the education, big education, was the Vice Chancellor of Madurai University and Madurai Commerce University and all that. He had Alagappa University and all that. He had diabetes for 60 years, 60. He got it when he was 40. He crossed 100. Still, he had no complication. Then finally, of course, due to old age, he passed away. All of us will pass away due to old age. But he did not have a single when he was 100 years old, he was giving speeches. I've got recorded speeches of his at the age of 100. So there are people who can live their full span of life despite diabetes. Somebody has asked, Karthikeyan has asked, can you tell us about vaccination for type 1 to improve immunity? It's a very important point. So many people have asked me today about vaccination. So vaccination, we'll talk in terms of COVID. For COVID, the vaccine is coming. It has not yet come, but there are so many leads that definitely by this year end, I think something will come. The Oxford vaccine has come. Our own COVAX in India is there. Russian vaccine is there. Chinese vaccine is there. So many vaccines are there. One of them are definitely going to come. But the trials are going on. It will take another 2-3 months. Oxford, they're saying September. I think by October, November, the vaccine may come. But by the time COVID may go away, that's the problem. Once COVID goes away, who will take the vaccine? Suppose there's no COVID at all. Zero COVID. Will you take COVID vaccine? I would hesitate. Why should I take it? When there's no COVID, why should I go and take COVID vaccine? So COVID is going on and on, then we can do. But COVID won't go like that. In Chennai, it's already started coming down. Okay, in Bangalore, it went up. Now it will start coming down. Mumbai is almost gone. Delhi is almost gone. Now it's gone to Madurai. Madurai is almost over. Now it's gone to Coimbatore. அப்படி வந்து சுத்தி இன்னொரு 2-3 மாசத்துல அடிச்சு போய்டும். ஒரு அலை வந்து அப்படியே அடிச்சிட்டு போற மாதிரி it will go away. Then there's no COVID. But there are certain diseases which come again and again. For example, pneumonia. Okay, pneumococcal pneumonia. If it comes, many old people die due to pneumococcal pneumonia. Most diabetics, even young people, if they get a lung infection, pneumonia, they die due to that. And if they get COVID and get secondary pneumococcal infection, it's very bad. So you can take pneumococcal vaccination, small vaccination, just poke it. Once you take pneumococcal vaccination, whole life you don't have to take. Ore or short term, whole life you're covered. Okay. Why wouldn't you take it? Cost about 1,000 rupees. Why don't you take that whole life? At least one condition, one important lung condition you will not get. Influenza. Influenza comes every year. Sometimes it can be mild. For diabetic patients, even that is enough to produce a severe kind of a thing, pneumonia due to thing. So you can take influenza vaccination. That's another small injection that you have to take every year because the trend changes every year. So you'll have to take influenza vaccine every year, pneumococcal once a year, if once in a lifetime. We recommend that these injections are taken now by every diabetic patient so that even if COVID comes, you will not develop secondary infection. Many people who are dying is because of secondary infections. So this vaccination, I highly recommend. Every day now, hundreds of people were giving this vaccine. We even send people to their homes and then get the vaccination done. WHO, ADA, all have recommended that they take. This is the only thing you can do now. COVID has to, vaccination has come, trial has to be over, whether it is needed or not. Tomorrow, suppose there is no COVID in the world. From December of 2020, there is no COVID in the world. Why take the vaccination? Suppose next 100 years COVID doesn't come. Yeah, it may be a way. So while all the research is useful for COVID vaccine, everybody is waiting. If COVID goes away, nobody will take it. Spanish flu on the poichu. Nobody took any vaccination against Spanish flu. SARS, MERS, Nipah, all these things which came recently and went. Nobody took any vaccination for anything, and yet it went away. Okay.
So, any other? I think we have almost answered all the questions. I don't think I have missed anything. So finally, நீங்க சொல்றது பார்த்தா there was one question I asked one spiritual guru. I was asking him, how do we endure the pain? He was talking about positive thinking and all that. I asked him, there is something called pain. How do we endure the pain? When you lose something, when there is something that goes out of hands, you have to endure the pain.
Yeah. He
said two things. You have to choose between to endure the pain of discipline or the pain of regret. அப்படின்னு சொன்னாரு. ஸோ இன்சுலின் போட்டுக்கிறதும் ஒரு டயட் பிளான் பண்றதும் ஒரு ப்ராப்பர் மேனேஜ்மெண்ட் மெத்தடாலஜிஸ் நீங்க சொன்ன எல்லா விஷயத்தையும் நம்ம வந்து ஒரு டிசிப்ளின்டா பண்ணோம்னா this pain is more beneficial when it is compared to the pain of regret. So இது எதுவும் பண்ணாம இருக்கும் பொழுது you regret. That pain is even more deleterious, very bad for the health of a human being.
I agree. In this case, that regret will be developing complications. Suppose your eye is gone, rendu kannum pochu. Then ayyo the insulin appear sonare potrukkalame. It's too late, no? Kannu மறுபடியும் கிடைக்குமா? Kidney போயிடுச்சு. லைஃப் லாங் டயாலிசிஸ் பண்ணோம், டிரான்ஸ்பிளான்ட் பண்ணோம். இல்ல டாக்டர் இப்போ நான் இன்சுலின் போட்டுருக்கேன், இப்போ போட்டு என்ன பிரயோஜனம்? அது முன்னாடி போட்டிருக்கணும் இல்லையா? இட்ஸ் ஜஸ்ட் டூ லேட். ஸோ அந்தந்த டைம்ல என்னென்ன தி அதர் திங் ஐ வுட் லைக் டு டெல் ஆல் பேஷண்ட்ஸ் இஸ் ப்ளீஸ் ஹேவ் ஃபெய்த் இன் யோர் டாக்டர்.
எக்ஸாக்ட்லி.
எல்லாமே ஃபெய்த் வச்சு தானே இருக்கு. யூ கால் மீ ஃபார் அ ப்ரோக்ராம். வை ஐ செட் எஸ், ஐ ஹேவ் ஃபெய்த் தட் மணிகண்டன் வில் டூ அ குட் ஜாப். வை டிட் யூ கால் மீ? யூ ஹேட் ஃபெய்த் தட் டாக்டர் மோகன் வில் டூ அ குட் ஜாப் when you come. அதுக்காக தான் யூ கால். அந்த ஃபெய்த் இல்லைன்னா கூப்பிட்டோன்னு ஏதோ மணிகண்டன் கூப்பிட்டுருக்காரு, சரியா இருக்குமா? ஃபெய்த் இல்லை, அப்போ வேணான்னு சொல்றேன் ஃபர்ஸ்ட். ஓகே, so that is how when you go to a doctor is telling you do a certain thing. Don't think எதுக்காக சொல்றாரு, பணம் அடிக்கிறதுக்கு பாக்குறாரா அப்படின்னு. Don't start thinking, we got other ways of making money, we got other ways of doing it. We didn't come into the world only to make money kaga. We didn't come, we didn't take this. I could have done so many other professions. I could have done to make, I can make 100 times more money than this. We are sitting here to help people. 50 years வந்து இன்னும் few more years இருக்க முடியுமா? Can we continue to help people? இந்த diabetes எடுத்துற முடியுமா? Those are the goals for which we are all aspiring. So have faith in the doctor. Don't keep on questioning. Google ஏதோ நீங்க படிச்சிட்டீங்கன்னா எல்லாம் தெரியற மாதிரி don't think. கூகுள்ல கண்டவன் ஏதோ எழுதியிருப்பான், அதுவும் வரும் கூகுள்ல. I'm not saying everything Google is wrong. Google is fantastic. So many things you learn, but everything in it is not truth. There's a lot of untruths also there. You go. Why do you said you went to a spiritual guru? Why do you go to spiritual guru? அவங்க கரெக்டா நம்மள அட்வைஸ் பண்ணுவாங்க, அவங்க நமக்கு பீஸ் கொடுப்பாங்க, சாந்தி கொடுப்பாங்க, அதை நம்பிதானே நாம போறோம். So once you have faith in that, then everything will be good.
Correct. So before I conclude, I would like to ask you two things. Tell us about MDRF's activities, Madras Diabetic Research Foundation, number one. Number two, I know that apart from your academic interest in research and as a practitioner with over 48 branches, you are also too much involved in community activities, that is charity. You have adopted to more than 20 villages in Kanchipuram. So why don't you tell us about MDRF as well as the charity and the community activities? Because I'm sure community is something which helps you to prevent the disease.
Absolutely. So I'll tell you about both. So research, when I started doing research when I was 18 years old, and then first 20 years my father, then we started when I came out and started on my own, Madras Diabetes Research Foundation we started. The grace of God, today it's one of the largest research centers. We have about 25 scientists, about 25 Ph.D. students, almost like a mini university for diabetes. Our research is manifold. One is clinical, following up patients, looking at their outcomes over 50 years. We have electronic records of almost 500,000 patients over 25 years. Adhuve, if you study itself, it gives you so much artificial intelligence. Second is epidemiology. We go into the field. I'm able to tell you, Chennai 71 la 81 la 91 la, because we've been doing follow-up of those studies. Then prevention. எப்படி prevent பண்றது, எப்படி இது பண்றது, that is a community based இது. Gestational diabetes, how to prevent gestational diabetes, how to treat it, pregnancy, அது ஒரு angle. Complications, கண்ணு, kidney, heart, each one we have got specialists doing that. In fact, my wife is one of the first eye doctors to look at diabetic retinopathy ன்னு சொல்றது. She is no more, unfortunately. So அந்த மாதிரி research இருக்கு. அப்புறம் genetics, finding out the cause, எதுக்காக வருது, மோடி genetics, இந்த genetics, and the Myri thing. So these are all the kind of studies which MDRF does. We are funded by nationally, internationally. We have collaborations across the world. Ethno universities, Harvard, Emory, Canada, McMaster University. There are so many universities, Europe, UK, ellam collaboration, Scotland, ellam we have collaboration, and in India also, All India Institute could have, Indian Institute of Science could have, IIT could have. We have a lot of other side MDRF இருக்குது. இது வந்து community based, இது வந்து we always felt that we should give back into the community. So what we have come up only because of the community, and we should give back to the community. So there are two aspects of it. One is through our trust. It's called direct. So where we mostly for children, but also some adults who are very poor, we give free insulin, free treatment, free. We are treating almost 400-500 children completely free. The Hinduja Foundation has joined us, and for 250 children they are supporting. There are other foundation support. If they don't support, then we ourselves support. We give a good part of my own personal income I keep for that, and then this gives a great amount of satisfaction. I'm also a devotee of Bhagavan Satya Sai Baba, so he has shown that his life is his message. Everything in the Satya Sai organization is free. Education is free, hospitals are free, super specialty hospital free, operation is free, everything is free, and I'm one of the Central Trust members there. Inspired by him, we run 3-4 diabetic clinics, some with the organization itself. So this organization itself, we have mobile clinics and all that. Then at one stage, we thought we should start adopting some villages. So a zamindar gave me a few acres of land. The zamindar of Chunampet, C. Ramakrishna, very kindly donated some land, and he said, "Konja nalladhu seipa enga aalungalukku." So I said, okay, and solittu on the 42 villages in and around Chunampet, first we screen. Adil or 20-25 villages idu panni adopt panni. Anga irukravungalukku ellarkum vandu either completely free or some very low subsidized cost ku we started treating. Our kudutha and the land la we built, my wife and I donated, and we built a property there. Anga vandu or free clinic and subsidized, complete free solla maten, half free, half subsidized vechittu. That is also going on Chunampetla. One Dr. Rakesh, he is from that place. He has joined me, and he is running that clinic for me. And anga nalla poitirukku. These are all the small ways in which we think we can give back to society. But what you have done is only a drop in the ocean. No, nariya seiya vendiyadhu irukku. We hope that if God gives me some more years of life, we'll be able to extend this seva to many more. I'm blessed also to have a very good team with me. Almost 1,300 people are there. இந்த டீம் இருக்கிறதுனால தான் ஒரு சைட்ல ரிசர்ச், ஒரு சைட்ல பேஷண்ட், ஒரு சைட்ல கவர்மெண்ட் கூட ஒர்க் பண்றது, ஒரு சைட்ல இது பப்ளிக் சேரிட்டி ஒர்க் பண்றது, இன்னொரு சைட்ல வந்து ப்ராடக்ட்ஸை கண்டுபிடிக்கிறது, புது ரைஸ் கண்டுபிடிக்கிறது, அப்புறம் வந்து ரூரல் ஒர்க் பண்றது. ஆல் திஸ் we are able to do and still focus on each one and take it to good quality, because I'm blessed to have the best of people. People who have joined me have never left me. 20 years, 25 years, 30 years என் கூடயே இருந்திருக்காங்க. Even if they leave me and go, they'll still collaborate with me. எங்க போனாலும், வேர்ல்ட்ல எங்க போனாலும், they'll still keep collaborating with me. That has been one of the blessings which I've had. அதனால தான் இவ்வளோ பண்ண முடிஞ்சிருக்கு. And of course, you also need the blessings of the Almighty. இதெல்லாம் நம்ம பிளான் பண்ணாலும், if from above you don't get the blessing, it is not there. I've been very blessed to have the blessings of my Guru.
Yeah. So mentioning the names of Hinduja Foundation and the Zamindars support to you only demonstrates your highest sense of gratitude, and also it shows the trust of employees on you. As an HR, I would like to visit your office to understand what's the magic working with your employees.
I can share a secret with you before we conclude, and that is that I've written my autobiography. Because many people told me, you have to put this into writing, otherwise people won't even believe what you have done. So I wrote my autobiography. In February I gave it, and it was supposed to come out in July. After that, COVID வந்தது. So Penguin is publishing it. I already signed the contract with them, already paid me in advance, and I've given my book to them, signed the legal contract, everything over. Then they said 6 மாசத்துக்கு book வராது, February it may come, because they've closed all, nobody is working there, and no publisher is publishing. I didn't want to publish in a small publishing house. I wanted to become an international brand. So அதனால end of this year or early next year வந்துரும் அது. It's been approved. இது பண்ணி even copywriting and all has started. அப்பதான் COVID வந்து stuck ஆயிடுச்சு. அதுல இதெல்லாம் இருக்குது. How we built institutions, how we gained the confidence of people. But we can talk about it.
How is the title? Is it named after your
one or two titles? Pursuit of Excellence, because I think excellence is the word which I like. Passion, excellence, these are the things which I like. So on the pursuit of excellence in everything, trying to do the best of the best, and excel that also. See, excellence is like a mirage. See, அங்க தண்ணி இருக்கிற மாதிரி இருக்கும், அங்க போனா இருக்காது mirage. It's gone further, Excellence, by the time you reach one level, excellence has gone higher. So you have to continuously, and the pursuit of excellence. You're continuously pursuing it. You can't say I achieve excellence. அதுக்குள்ள standard down ஆயிடும். So அதுக்குள்ள next you have to keep on going. அதுக்கு வந்து you need the teamwork. Everybody must be charged like you. Then it will come.
Yeah, thank you so much, doctor. Right from the treatment methods, prevention, diet plans, management techniques. So almost I think you covered overall a lot of things which will add a lot of value to the viewers. And we've also taken 1 hour and 20 minutes now. So all I would like to say is, the initial intention when I started Change Agent Foundation is to spread the message. And so far, God has been so kind that I'm able to spread the message with the right kind of people, only the experts. As I was telling you initially, the cumulative experience and the average experience again stands a testimony to that fact. And secondly, again, when I was talking to the Guru about the happiness, he said 3 things: acquire, apply, and share. And I'm sure this is what we have done today. And Dr. V. Mohan, you have done this for us today. Thank you so much. And I will be running this video separately to understand, because I'm going to get a lot out of this 1 hour discussion with you. On behalf of Change Agents Foundation, thank you so much from the bottom of my heart. Thanks for all your time. Nandri.
Thank you, Manijandan. Let me give you my blessings. Since I'm older to you, you're doing a great job. And Change Agent is exactly what everybody should be, trying to change the world. And we should be part of that change ourselves, as Mahatma Gandhi said. So you be the change that you want to see in the world. So I think being a change agent yourself, Manikandan, is actually doing that. I'm very happy to join you at any time. If we set up the time and we fix it, I'd be very, very happy to, because I think we have a lot of things in common, and we can definitely try to help society.
I will also think of a series with you.
God bless all the viewers who have been watching. Thank you for watching. If you have not answered all your questions, there are more opportunities in the future, so stay tuned. Thank you. Please
share your feedback, viewers, and your feedback will influence my future decisions. Thank you so much. And thank you, doctor, once again. Thank you. Yeah.
Thank you. Bye-bye.